Hi everyone, I'm Dr. Sanil Rege, consultant psychiatrist and academic lead of Psych. In this video, I'm going to provide some key tips to help you pass the RANZCP MEQ exam, the modified essay question component. The MEQ exam is a critical and arguably one of the most challenging components of the RANZCP exam. The modified essay question is designed to simulate the complexity of real-world psychiatry. It goes beyond just diagnoses to examine how you synthesize and apply complex clinical information. I'm sure you've heard it's a tough exam, and to be quite honest, it is. But mastering the skills in the MEQ will also help you become a competent psychiatrist, because it is exactly these skills that are necessary for good real-life clinical practice. The good news is that it's possible to pass this exam once you have the right strategy in place. How do I know this? Because I've been in your position. I've experienced the pressure of this exam, but more importantly, I've developed the strategies to help registrars get through this critical component. Over the last 10 years, we've helped more than 3,000 registrars pass their exams, many of whom are consultants. Helping individuals get through the exam has helped me understand what works and what doesn't work, and that's what I'm going to summarize and provide to you in this video. I know you have loads of questions: where to begin your studies, what books to read for the MEQ, what tools will give you an advantage. These are the same questions that I had, but the key thing to recognize with the MEQ that it's not about the textbook. With the MEQ, being knowledgeable is important, but the real challenge of the MEQ is to use that knowledge effectively and translate it into problem solving or a diagnostic understanding. And in order to do that, it's not just about putting long hours aimlessly. It's about studying smartly and with purpose. Most of the study that happens in preparation for the MEQ is actually thinking and reflecting. But in order to think and reflect, one must have the ingredients, the framework, the foundation to think and reflect effectively. You see, one of the key challenges with the MEQ is its unpredictability and the depth required. It's not like the multiple choice questions or the EMQ, where there is one correct answer. MEQ is about navigating uncertainty. Your responses in the MEQ should reflect that uncertainty and highlight your ability to synthesize the information, the patient nuances in patient presentations, and respond with a treatment plan that's as multidimensional as the patients we see in clinical practice. And that's what makes the MEQ challenging, because as part of day-to-day registrar training, we're not often forced to think broadly. This exam will stretch your thinking in ways that clinical rotations might not have. It tests your ability to think like a psychiatrist, moving from a registrar towards a consultant, thinking broadly and with the relevant depth that is needed in the different domains. Approaching the MEQ requires a mindset of flexibility, critical thinking, and a willingness to explore beyond the surface. The vignette that is provided in the exam has specific information that you, as an examinee, must synthesize and highlight to the examiner. It demands a balance between the confidence in your knowledge, but also the humility to consider each case with fresh eyes. And this humility is highlighted by showing how you navigate uncertainty. The successful candidate approaches the MEQ with a mindset similar to a chess player, anticipating moves, considering outcomes, and making decisions that are several steps ahead. So with that foundation in mind, let's delve deeper into the strategies to help you pass the MEQ. First, understand the vignette. Read the question carefully. Take the necessary time to absorb the information presented in the vignette.
It is important to state here that in the immediate phase, the focus is on risk management and symptom control.
Identify the key elements that are crucial to forming your response. 2. Specificity is key. Generic answers won't score you marks. Be specific in relating each part of your answer to the vignette in the exam. 3. Understand the difference between understanding the problem versus solving the problem. The questions of the MEQ broadly cover these two aspects. Either they want to test your understanding of the problem, or they want to see how you implement a plan in relation to problem solving. And finally, integrate and apply. time. And what I mean by that is your response should directly relate to the vignette. Integrate and synthesize your clinical knowledge with the practical application of that knowledge. So these 4 strategies help you form the foundation in understanding. This understanding then needs to be communicated. As part of communicating your understanding on paper, it's helpful to provide this information in domains. For example, there are diagnostic domains, or there are problem-solving domains, example, CAN-METS domains. For the diagnostic domain, one may employ a diagnostic hierarchy. Essentially, just as in real-life clinical practice, we all need a framework to expand our horizons when we're addressing patient scenarios. The same foundation needs to be applied in the MEQ. So let's look at a couple of examples. Imagine a vignette where a patient is presenting with depressive symptoms, anxiety spectrum symptoms complicated by recent bereavement, and alcohol use. Here you can see there are key domains. There are symptoms spanning the depressive spectrum, the anxiety spectrum, the bereavement aspect, and the alcohol use. Here it becomes important. The question could be framed as a management scenario or a diagnostic understanding. In the diagnostic understanding, it's not sufficient just to write down the diagnoses of major depressive disorder or generalized anxiety disorder, alcohol use disorder, etc. Here, there will be specific aspects mentioned in the vignette that need to be integrated as a diagnostic formulation as well. For example, in the vignette, they may highlight that this patient has not responded to 2 different SSRIs. How does that link to the alcohol use is one important diagnostic clarification. For example, highlighting that alcohol use disorder may be associated with vascular involvement of the brain, i.e. a vascular depression, which itself is linked to treatment resistance, is then an explanatory model to highlight why the patient hasn't responded to 2 different SSRIs. Second, the patient may not have responded to the 2 different SSRIs because they may be unresolved grief. Similarly, in the management scenario, when they ask you to implement a management plan, it's not sufficient to provide a generic guideline-based response about treatment of depression. Here, one has to consider what are the specific management strategies for alcohol use disorder comorbid with depression and anxiety. Similarly, how does one integrate the psychological treatment of the anxiety disorder and the alcohol use disorder? These nuances form the basis of your answer. Another example, consider a young adult with first episode psychosis who is experiencing side effects to medication, for example, risperidone, 6 milligrams. Here, the patient wants to stop their medication. The question may ask you, what are the key examination and investigation findings that you would consider in this case? Here, the candidate should broaden their horizons and think about the different dopaminergic pathways that they would examine. Those pathways will then lead to both the examination and the investigation findings. For example, examination of the mesolimbic system for positive symptoms, examination of the mesocortical pathways for negative symptoms, secondary depressive symptoms, or cognitive examination. Now, these are the frameworks that you're using in brainstorming. The way you write the answer will reflect it. The domains that you put on paper differ. What you write on paper will, of course, differ depending on what the question has asked. Essentially, one of the best ways of communicating is through domains, as you can see here. To summarize, in preparing for the MEQ, the integration of your clinical knowledge with practical application is a key, and an emphasis on the practical application. Your answer must reflect the nuances that are present in the vignette. When you articulate your response, ensure that it is rooted in the specific details of the vignette. Each aspect of your answer should be justified with evidence and rationale, demonstrating that you can transfer what you've learned in textbooks and lectures to the patient in front of you. Candidates will often get bogged down between what's outlined, what is list and justify, what is describe, or what is described or discuss in debates. The fundamentals remain the same. Your response should factor in the time available and provide that synthesis on paper. As we wrap up, remember that the MEQ is your opportunity to show how ready you are to step up into the role of a consultant psychiatrist. At Psych, our courses help you do just that. Through a combination of video lectures, notes, and answers, we help you prepare effectively for the RANZCP MEQ exam. As part of the video lectures, I take you through the different exam questions and highlight how one would write down the domains and provide the necessary depth under each domain. Through the video lectures and the answers provided, we've covered more than 100 themes that have come up in previous exams. However, it's not just about rote learning these themes. It's more about using the information and spending time reflecting on these answers and then practicing your communication by writing them on paper. So if you're looking for guidance that will help you get through the RANZCP MEQ exam, but not just that, also help you prepare for real-life clinical practice, then explore psychscene.com and see what's on offer to help you get through the exam. At Psychscene, our mission is not just about helping you get through this exam. It's also about ensuring that you're ready for real-life clinical practice. And by focusing on your future, we ensure that you also get through your exams. Because the strategies required for the real world are the same strategies that will help you in your MEQ exam. So I hope that you found these tips valuable. I wish you all the best for your exam and your future. Bye-bye.